Hello student, in this video lecture we are going to discuss about sleep disorder, which is the important topic from the psychiatric. Before we start the lecture, you must keep your notes in front of you that helps you to understand easily. Okay, as now we starting the topic. As you all know that sleep is a basic physiological need, or we can say it is a biological motive according to the Maslow hierarchy, in which we are discussing that according to Maslow hierarchy it is a triangular that defines your needs, and there are the 5 stages of the Maslow hierarchy. The basic need that is such like hunger, thirst, breathe. Including that, there is another physiological need, that is sleep. Sleep is mandatory, necessary for everyone for the better life, for better doing. Sleep process is influenced by multiple body system. बहुत सारे बॉडी सिस्टम मिलके आपके स्लीप प्रोसेस को, पैटर्न को परफेक्ट बनाते हैं, इन विच वी इंक्लूड नर्वस सिस्टम, एंडोक्राइन सिस्टम, मस्कुलर सिस्टम. Your nervous system releases some neurotransmitters that influence your sleep. Endocrine system also secretes some hormones which influence your sleep. And muscular system, when your hormones, neurotransmitters are released from nervous system and endocrine system, by a parental process your muscles will be relaxed, and you got a better sleep. For if we are discussing the neurotransmitter, according to the neurotransmitter hypothesis, our body have a pattern of sleep in which, if the serotonin and non-epinephrine level in our body decreased, that induce the sleep. जब सीरोटोनिन का, नॉन एपिनेफ्रिन का लेवल कम होगा तो आपकी स्लीप बढ़ेगी. Second is that during dark, it's about the night, your pineal gland secretes melatonin. Melatonin, that is called circadian rhythm or biological clock in our body, that induced sleep. Okay. Next, if we are talking about the pattern of on the pattern of sleep, we are talking about the types of sleep. Your sleep may be two types. First is non-random eye movement sleep, that is also called orthodox, in which we can divided the sleep, a complete sleep, in the 4 stages. The first stage is your stage first is in which your sleep is lightened and your muscles are relaxed. In the second stage, sleep is still light, you are not in complete sleep, but the K complex, you can see the K complex on not ECG, on EEG, on EEG, that is इलेक्ट्रोएंसेफेलोग्राम. यहाँ पे आपको इलेक्ट्रोएंसेफेलोग्राम पे के कॉम्प्लेक्स दिखाई देगा, दैट इज दैट के कॉम्प्लेक्स इज ए वेव फॉर्म. आपको एक वेव दिखाई देगी ऐसे, जैसे ECG पे वेव दिखाई देती है ना, सेम लाइक दैट इलेक्ट्रोएंसेफेलोग्राम पे जब आप करते हैं पेशेंट का, तो आपको के कॉम्प्लेक्स पैटर्न दिखाई देगा. एंड इट इज द के कॉम्प्लेक्स, what the K complex suggests, that K complex suggests that it is the largest event in the healthy human being. If that person having the a perfect sleep, your K complex is good, in the range, on the EEG. Okay, rather than that, your heart rate and temperature will be decreased during the sleep, during the second stage of sleep, because your muscles are completely relaxed and temperature and heart rate will be down. Okay. In the third and fourth stage, you have the 80% of total sleep. You have the total 80% of total sleep, and it is, we call the deep sleep or relaxed sleep or complete sleep, in which your thoughts are blunt and your muscles are completely relaxed and you are in the dreamy stage, you are completely relaxed. Okay, these are the third and fourth stage. Next one is another type of sleep is random eye movement sleep, or it is also called the paradox. It is the sleep when you goes into the bed for the sleep. जब आप सोने के लिए जाते हैं, जो when you are in the thought process, when you are criticizing yourself, when you are talking with yourself, that time of sleep is known as random eye movement sleep. When your brain, when you are questioning to yourself and when you are going through some answers, जब आप अपने आप से कुछ बातें कर रहे होते हैं, अपने आप को ढूंढ रहे होते हैं, जब इट इज़ द अर्ली टाइम व्हेन यू आर गोइंग फॉर द स्लीप, that is called random eye movement sleep or paradox. Okay, so it is the general classification of sleep according to the pattern of sleep. Now we are discussing the sleep disorder according to the ICD-10. Your sleep disorder may be classified in the chapter F, from F50 to F59, from F50 to F59. वहाँ पे हम डिस्कस करते हैं ICD-10 में. देर आर टू टाइप्स ऑफ sleep disorder in which we can say first is dysomnia. That means it is a sleep disorder which are characterized by abnormality in the amount, in the quality or timing of sleep. Dysomnia means you does not have a proper sleep. Okay, that is called dysomnia. Dysomnia may be further classified proper sleep. That means maybe you are having the heavy sleep even after the night in the daytime, or another one is you did not have the sleep. So dysomnia means abnormal sleep, abnormality in the amount, quality and timing of sleep. First, dysomnia is classified into two categories, in the insomnia and hypersomnia, that we will discuss later. Okay, and another one is parasomnia. Parasomnia means unusual behavior, unusual behavior that occurring during sleep, that is called parasomnia. ठीक है, when you are doing something extra in your sleep rather than the sleep, that is called parasomnia. Okay, first we are discussing about the insomnia. Insomnia, that means difficulty in maintaining sleep. Okay, insomnia, that means difficulty in maintaining the sleep or sleep pattern. ठीक है, in the insomnia, patient is unable to get sleep. ठीक है, there are so many causes in our day to day life that may cause insomnia, such as stress, other psychiatric disorders such as mania, anxiety, delirium, some medical illness like benign prostate hyperplasia, benign prostate enlargement of prostate gland. Due to that, you have the blood urinary incontinence, मीन्स बहुत ज़्यादा आपको यूरिनेशन होता है, जिस वजह से अच्छी स्लीप नहीं आती, साउंड स्लीप नहीं आती. रदर देन COPD, इफ़ यू हैव द ब्रीदिंग प्रॉब्लम. ठीक है, if you have some heart failure, congestive heart failure, some allergy you have, if you are in the pain due to some accident, due to some trauma, you can't get a proper sleep. Rather than the psychological, psychiatric or medical illness, you have some drugs which can decrease your sleep, such as alcohol use. Excessive use of alcohol can decrease the sleep. Narcotics, nicotines, coffee, these are the CNS stimulant drugs which can stimulate your CNS and you are not getting the proper sleep. Another type of medicine such as beta adrenergic blockers. ठीक है, बीटा एड्रेनर्जिक ड्रग्स, इफ़ वी आर डिस्कसिंग अबाउट दैट, मैं आपको बता दूं, बीटा एड्रेनर्जिक ड्रग्स वी आर यूजिंग टू रिड्यूस द बीपी पैटर्न. How it reduce the BP? By blocking the hormone epinephrine, that is also called adrenaline. That hormone is blocked by the beta adrenergic blockers, and that may cause decrease in BP. But you know that epinephrine, non-epinephrine, those are help into the maintaining your sleep pattern. When you did not have the when you did not having the when you have the decreased level of non-epinephrine, you get the sleep. But if the beta adrenergic blockers that stop the epinephrine, okay, then opposite hormone will be increased, that is non-epinephrine, and that may cause inability to sleep, that may cause insomnia. Okay, how we can manage the insomnia? We can manage the insomnia by using anti-anxiety drugs such as benzodiazepine. benzodiazepine Benzodiazepines are the anti-anxiety drugs. Okay, rather than we can use the we can also use the antidepressants. ठीक है, and rather than that we can use the cognitive therapy that we will discuss in the psychotherapy chapter. But here I introduce something regarding the cognitive therapy. Cognitive therapy, in the simple meaning, cognitive therapy, what will happen with you in the cognitive therapy? Here the therapist will replace the disorganized negative thoughts feeling by the positive thoughts or feeling. ठीक है, you just remember that in the cognitive therapy what we will do, we just replace the disorganized negative thoughts, negative feelings by the positive attitude, positive feelings, positive thoughts. Okay, that is cognitive. Same like that, the relaxation therapy is a therapy that helps you to maintain the relaxity, that can relax your brain, that can decrease the brain waves in your brain. Okay, it is such like there's a music therapy. Music therapy is a part of relaxation therapy. Okay, so this is the management. In the management, what we can use? We can use benzodiazepine, we can use antidepressant, we can use antidepressants such as we are discussing in the pharmacology. But you just remember that SSRI, MOIs, and TCA वाली ड्रग्स जो हम एंटी डिप्रेशन ड्रग्स में पढ़ेंगे आगे, वो हम इसमें काम में लेते हैं. उसके अलावा हम कॉग्निटिव थेरेपी दे सकते हैं, रिलैक्सेशन थेरेपी दे सकते हैं. नेक्स्ट इज हाइपरसोमनिया. what will happen with your sleep in the hypersomnia? You have the excessive sleep even in the daytime. Hypersomnia, that means excessive sleep even at the daytime also you have the excessive sleep. There are so many causes behind it. और ऐसा नहीं है कि आप दिन में ही सोते हैं. यू हैव ए प्रोलॉन्ग्ड स्लीप एट नाइट आल्सो एंड आल्सो इन द डे टाइम. सो यू हैव द एक्सेसिव स्लीप, दैट इज कॉल्ड हाइपरसोमनिया. व्हाट आर द कॉजेज? द मेन कॉज इज narcolepsy. Narcolepsy is a term that is used for same like the hypersomnia, in which you have the cataplexy, your sudden loss of the muscle tones, and your muscles will be relaxed and you getting the sleepiness. Okay, another one is sleep apnea. ठीक है, snoring, stop breathing during the sleep. These are the main causes of the hypersomnia. Other than that, such as head injury, brain trauma, encephalitis. ठीक है, these are another cause of hypersomnia. One another is that Kelvin-Levin syndrome is there. Kelvin-Levin syndrome is Kelvin-Levin. You can see in your notes Kelvin-Levin syndrome. What is the Kelvin-Levin syndrome? It is the rarest disorder in which genetically you have some problem and you have the episodes of excessive sleep. ठीक है, दैट इज़ कॉल्ड कैल्विन लेविन सिंड्रोम. ठीक है, याद रखना, कई बार एग्जाम में पूछते हैं कैल्विन लेविन सिंड्रोम होता क्या है. दैट इज़ एक्सेसिव स्लीप एपिसोड्स. ओके, ड्रग्स कौन सी देते हैं हाइपरसोमनिया में? वी कैन यूज़ द CNS डिप्रेसेंट, वी कैन यूज़ द एल्कोहल टू डिप्रेस द स्लीप. ठीक है, by the effect of alcohol, if you have the mild effect you can go to sleep, but you have the excessive, you can some aversion therapy we can use in that. Okay, and we can manage the hypersomnia by the behavioral therapy, drugs to treat the underlying causes such as brain trauma, encephalitis and etc. Next we are going to discuss about the another type of sleep disorder, that is parasomnia. Parasomnia have the two types of further classification, in which we are discussing about the stage 4th parasomnia. Stage 4th parasomnia means you are, if the person doing something extra during the sleep, that is called parasomnia or abnormal behavior, in which unusual psychological event that occurs during sleep is called parasomnia. First we are discussing in the parasomnia the stage 4th disorder, in which we are discussing first is, you can see in your notes, somnambulism. Somnambulism means it is found in the age of 5 to 12 years. ठीक है, that means here I mention that clearly on bracket, the sleepwalking. The patient, मोस्टली हम स्लीप में रेस्ट करते हैं, बट यहाँ पे पेशेंट क्या करता है, स्लीप में वॉक करता है और एक जगह से दूसरी जगह चला जाता है. फॉरगेटफुलनेस, व्हेन यू आस्क हिम और हर हाउ यू केम हेयर, दैट पेशेंट इज हैविंग नॉट आंसर. उसको खुद को मेमोराइज नहीं होता कि वो यहाँ पे कैसे आया. सेकेंड डिसऑर्डर इज ब्रुक्सिज्म. ब्रुक्सिज्म दैट मीन्स टीथ ग्राइंडिंग, अपने दांत पीसता है नींदों में, दैट इज कॉल्ड ब्रुक्सिज्म. ये भी एक अबनॉर्मल बिहेवियर है ड्यूरिंग द स्लीप. नेक्स्ट आता है सोलमैन क्वी. सोलमैन क्वी मीन्स स्लीप टॉकिंग, सम बड़बड़ाता है, बातें करता है स्लीप नींद में, दैट इज कॉल्ड सोलमैन क्वी. नेक्स्ट हेयर वी मेंशन pavor nocturum. Pavor nocturum means sleep tremor. A jerky movement start during the sleep, that is called pavor nocturism. Okay, then next aneurysm, that you know that it is childhood disorder most commonly. Aneurysm that means bed wetting, रात को बेड को ख़राब कर देना, पेशाब कर देना, टॉयलेट कर देना, that is called aneurysm. Night murmur is another term that is used in the parasomnia, that is night murmur. It is called the dream anxiety. The patient is afraid in the dreams. Sweating होती है, patient को पसीना आ जाता है, थोड़ा सब में होता है, but when it is goes excessive, that is called a parasomnia sleep disorder. Okay, these are the sleep disorder, parasomnia sleep disorder in the stage 4. Some another disorders are there, such as these are called another parasomnias, such as nocturnal angina, चेस्ट पेन हो जाना नींद में ही, हाँ, नॉक्चुरल अस्थमा, सांस लेने में डिफ़िकल्टी होना, नॉक्चुरल सीजर्स, उसको सीजर्स आते हैं, और नॉक्चुरल पेनिल ट्यूमर्स. ठीक है, these all are the parasomnia. Parasomnia, you must remain that there are two types of sleep disorder. One is parasomnia, another one is dysomnia. Dysomnia can be dysomnia, that means the sleep disorder which are characterized by abnormality in the timing of sleep, in the quality of sleep, in the amount of sleep. And parasomnia, that means unusual behavior during the sleep, that is called parasomnia. Dysomnia can be further classified into insomnia and hypersomnia. Parasomnia can be divided into the stage 4th disorder and other disorder. Sleep disorder can be managed by the behavioral, it can be managed by behavioral therapy. ठीक है, it can be managed by the behavioral therapy or by the anti-anxiety drugs, anti-depression drugs. ठीक है, we can use another therapy for the parasomnia. We can use some type of therapy that is called hypnotism. ठीक है, in which we hypnotize the patient by a psychologist or psychotherapist can hypnotize the patient and ask some questions regarding the personal life of patient. वहाँ से हम पेशेंट का पर्सनल रिग्रेट निकालते हैं. By that personal regret, that personal regret suggests you what is the actual problem, what is the underlying causes of that sleep disorder, and the psychologist, psychotherapist can treat the underlying causes. That sleep pattern must be goes okay. Okay, thank you class. If you have any doubt, you can ask me at any time. Hope you enjoying this lecture. Okay, thank you.